Welcome to USMLE World, where we ask, answer, and explain USMLE questions. Today, we're diving into Step 2, Surgery, focusing on cardiothoracic surgery. Let's get started with question number 1. For the following case, which of the following is the most likely diagnosis? A. Infective endocarditis. B. Intracardiac tumor. C. Left atrial thrombus. D. Myxomatous valve degeneration. A. Rheumatic mitral stenosis. The case scenario is: a 43-year-old woman comes to the emergency department with acute onset, left-sided weakness. The patient reports increased fatigue, low-grade fevers, and occasional palpitations over the last 3 months. She has lost 6 kilograms, or 13.2 pounds, during this period. She has no prior medical conditions and takes no medications. She does not use tobacco, alcohol, or illicit drugs. Temperature is 37 degrees Celsius, blood pressure is 120/76, pulse rate is 80 beats per minute and regular, and respiratory rate is 14. There are no carotid bruits. The thyroid is normal in size and there is no tenderness. Cardiac examination shows normal S1 and S2 and a mid-diastolic rumble at the apex. The lungs are clear on auscultation. Neurologic examination shows left-sided weakness. Laboratory results show a hemoglobin level of 10.2 and an ESR of 60. Brain imaging reveals multiple small, acute infarcts in the right parietal and temporal lobes. Transthoracic echocardiography shows a mass in the left atrium. The question is: which of the following is the most likely diagnosis? Your options are: A. Infective endocarditis. B. Intracardiac tumor. C. Left atrial thrombus. D. Myxomatous valve degeneration. A. Rheumatic mitral stenosis. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is B, which is intracardiac tumor. This question is designed with the focus to assess your ability to make a diagnosis. This patient with acute onset, left-sided weakness, and a left atrial mass identified on echocardiography likely has an atrial myxoma. Myxomas are benign tumors and are the most common primary cardiac neoplasm. Approximately 80% arise in the left atrium. Fragments of a left atrial myxoma can embolize into the systemic circulation, leading to stroke or other acute ischemia, like limb or mesenteric ischemia. Left atrial myxomas frequently obstruct blood flow from the left atrium to the left ventricle, leading to a murmur mimicking that of mitral stenosis, which is mid-diastolic rumble at the apex. The obstruction can also lead to decreased cardiac output that manifests as dyspnea, lightheadedness, or syncope. Because the mass is typically mobile, obstructive symptoms may be transient and influenced by position. For instance, mitral obstruction is exacerbated by upright posture but is alleviated by lying down. Tumor movement occasionally causes a characteristic tumor plop sound at the end of diastole on auscultation. In addition, some myxomas can produce cytokines like interleukin-6 that lead to systemic inflammation, which is evidenced by an elevated erythrocyte sedimentation rate and constitutional symptoms like fever or weight loss. The diagnosis is typically established by echocardiography, and prompt surgical resection is recommended to minimize the risk of embolization and sudden cardiac death due to impaired cardiac output. If you choose any option other than B, you are wrong. Let's briefly discuss the other options. Choice A cannot be the answer because although infective endocarditis can cause fever, weight loss, and systemic embolization, echocardiography typically shows valvular vegetations rather than an intracardiac mass in the atrium as seen in this patient. In addition, infective endocarditis typically causes a regurgitant rather than stenotic murmur. Choice C cannot be the answer because left atrial thrombus can develop in atrial fibrillation and lead to systemic embolization. However, this patient's history of low-grade fevers, weight loss, and elevated erythrocyte sedimentation rate are more consistent with myxoma. Choice D cannot be the answer because myxomatous valve degeneration is the pathologic cause of mitral valve prolapse, which characteristically produces a mid-systolic click rather than mid-diastolic rumble. Choice E cannot be the answer because worldwide, rheumatic heart disease is the most common cause of mitral stenosis, which produces a mid-diastolic rumble and can lead to atrial fibrillation and left atrial thrombus with systemic embolization. However, rheumatic heart disease is uncommon in developed countries. In addition, mitral stenosis typically develops years after the initial episode of rheumatic fever. Although rheumatic fever recurrences may cause fatigue and low-grade fever, such recurrences usually involve pharyngitis and are rare in adults. Your take-home message from this question is that myxomas are the most common primary cardiac neoplasm and usually arise in the left atrium. Fragments of the tumor can dislodge and lead to systemic embolization, like stroke and acute limb ischemia. The tumors may also cause position-dependent obstruction of the mitral valve, leading to a mid-diastolic murmur and symptoms of decreased cardiac output, like dyspnea and syncope. Constitutional symptoms, like fever and weight loss, may also be present. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. But if you don't know the answer, you really need to watch this episode again. Remember, knowledge is the foundation for growth. Unlock the secret to acing your medical exams, especially the Usmle, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.